Good day to our panelist and English teacher, Dr. Donisita Giro Moore. I am Maria Cyril D. Barrera, and for today, we would like to present our proposed study entitled The Effects of Teenage Pregnancy Among Grade 10 Students in Betis National High School, proposed for Sex Education Seminar School Year 2021 to 2022. Together with my group mates Mr. Giancarlo Dizon, Miss Erica Pablo, Miss Rowan Reyes, Miss Bea Magpayo, and Miss Denise Dizon. For the introduction of the study, here is Mr. Giancarlo Dizon.
Thank you, Ms. Cyril Barrera. Introduction. The globe can seem to tackle the problem of early childbearing. Because of its expanding number after 2010, it has become a phenomenon for most individuals. Many other countries face the same problem as the Philippines. One of these countries is the United States of America. Although teen pregnancy rates have decreased in the United States, it remains too high. Every day, about a thousand participants give birth to its child, and babies born to the participants have a higher risk of prematurity or medical complication. Having a kid at a young age can have a significant impact on its participants' ambition, aspiration, and even its life. Teenage pregnancy is a global issue of which no solution yet has been found. According to the National Demographic and Health Survey, 1 out of every 10 participants aged 15 to 19 has started having children. The lack of understanding about sexuality education and reproductive health among teenagers is one identified cause of these types of pregnancies.
And for the related literature, here are Miss Erica G. Pablo, Mr. Giancarlo Dizon, and me, Cyril Barrera.
Thank you, Ms. Cyril Barrera. According to Shadlock 1984, given the ongoing public debate about the provision of contraceptive service to teens, health education, and contraceptive service, providers should carefully assess the impact of their program on teenage pregnancy rate. And according to Bolton 1981, but the medical community and the general public are becoming aware of the importance of adolescent contraception and the disastrous repercussions of failing to provide it. Forrest 1990 state that in all nations save the United States, the more realistic acceptance of sexual activity among teenagers and the provision of contraception contrasted with the societal ambivalence in the United States. Based on Adler 1984, an overview of study findings from the United States on the psychological and social factors linked to undesired pregnancy, as well as the repercussions of unwanted pregnancy was offered. Alexander 1993 state that fear of their parents finding out about their visits, concern of pelvic exams, and fear of health implications from the field of are among the reasons given by youths visited at family planning clinic. And according to Pips Jonas, 1980, the states of our present knowledge is appraised by reviewing medical and non-medical studies of teenage pregnancies and its outcome. And according to PALM 1981, the physical, medical, social, economical, and psychological components of the problem are evaluated and discussed in order to give the physician with option for preventive and corrective approach to adolescent pregnancy.
According to Dreyfus 1985, in the United States, the proportion of sexually active teenagers has remained stable or even decreased slightly. Marital births to teenagers have decreased significantly, resulting in an increasing proportion of births to teenagers occurring outside the marriage. And the number and rates of abortion have remained stable for several years. Pearson 1995 states that to examine disparities in their characteristic, use, and experience of local family planning services, a comparative studies of 167 pregnant teenagers in Devon who attended either her prenatal booking clinics of NHS termination of pregnancy was conducted based on RUSA 1982 in order to discover causal factors connected to observed development mental abnormalities among children of adolescent parents. Researchers evaluated data on teenage parenting as well as medical and behavioral studies on child's development. Dorrell, 1994, said, a live delivery occurs in around half of all adolescent pregnancies, and the majority of these mothers are unmarried and will not complete high school. Fielding, 1991, said, adolescent pregnancy, which is typically unintended and unwelcomed, as a detrimental influence on the pregnant teen's physical, emotional, and educational finance well-being. According to Thompson, 1995, one factor of the original pregnancy and subsequent unwanted pregnancy, according to the responses, was irregular contraceptive usage. Fielding, 1987, states that if it weren't for the recent liberalization of legal abortion and the greater availability of contraception to teenagers, this tendency would be far more pronounced.
According to Greer 1982, Program Policy and Planning, Major Literature Reviews on Adolescent Sexuality, Female Development and Early Coitus, The Male Partner, The Competent Adolescent Contraceptor, and the Future Research Directions are all addressed psychological sequelae of early coitus in girls, factors affecting delay of first coitus in girls, and the promotion of competent contraceptive behavior. Also, 1980 states that according to a review of a recent studies on pregnancy resolution among unmarried adolescent women, individuals who seek and complete an abortion are not unique demographic but share many social and psychological traits with their peers. And Emma 1983 says that this analysis of sexual behaviors among sexually active teenagers looks at developmental difficulties, contraceptive use, adolescent pregnancy and its complications, and sex education. According to Becerra 1984, the impact of acculturation on attitudes toward pregnancies and motherhood, contraceptives and reproductive information, and the role of family and peers as behavioral models and support networks was investigated among Mexican American adolescents. Finkel 1983 states in the previous 2 decades, legislative acts and legal judgments in the United States have gradually expanded teens' access to family planning, abortion, and sexual information. According to Gispert 1984, the presence of the girl's fathers in the household was linked to regular contraception, usage, and a positive relationship between the girls and their moms. For the conceptual framework, this table showed right here is provided to help the readers understand the research. Input seeks to display the respondents' profile based on their age, economic status, health issues, and educational status, while the process demonstrates how to analyze the impact of teenage pregnancy among the grade 10 students in Betis National High School. And the output indicates the intended assessment of the problem using the main proposal of this research, which is the sex education seminar as a basis. And for the statement of the problem, here is Miss Rowana Rose Reyes.
Statement of the problem. At this time, teenage pregnancies worsen as obstetric problems, which are associated with an increased risk of anemia, urinary tract infections, hypertension, and preeclampsia. Teen pregnancies carry extra health risks to both the mother and the baby. Often, teens don't get prenatal care soon enough, which can lead to problems later on. They have a higher risk for pregnancy-related high blood pressure and its complications. Risks for the baby include premature birth and low birth weight. And how to solve this problem? By educating the youth about sexual and reproductive health, even in non-formal education settings, and normalizing respectful dialogue on the topic, providing rights-based measures to help pregnant girls and young mothers continue and finish their education.
For the significance of the study, here is Miss Erica Pablo.
Thank you again, Ms. Cyril Barrera. For significance of the study, this research enables the participants to fully comprehend the benefits and drawbacks of participation in a sexually active relationship, as well as the repercussion of doing so. The following people and organizations will benefit from the study's findings. The participants could get perspective on their situation and become more mindful of their parental and student duties. They will obtain a better knowledge of the realities of student mothers, as well as learn about the experience of student mothers. Research will gain a better understanding of the experience of college participants. Guidance counselor, the findings and observation would provide them with useful information for their counseling efforts. Faculty and administration will offer them with information to help them promote, improve understanding, and support programs for the participants in order to help them cope with their position. Research continues to confirm the adverse social, economic, and health consequences of teenage pregnancy. The long-term consequences include lowered educational achievement, medical complication, higher subsequent fertility, low labor force participation, reduced earnings, a lifetime of economic stress, and limited opportunity, and marital failure. The long-term effect on the impact includes an increase in incidence of both mental subnormality and neurologic problems. In response, many programs have been initiated by schools, community, and church groups, as well as state and federal agencies to address the problem of adolescent pregnancy.
For the scope and limitation, here is Ms. Bea Magpayo.
Research focuses on the impact of teen pregnancy among grade 10 students in Betis High School. The researchers will now look into other issues that are not related to teen pregnancy. The researchers will not include other students who do not fall within the category of grade 10 students. The research will be conducted using a survey and reference questionnaire distributed to students. The research will use this as a technique to determine the impact of teenage pregnancy on grade 10 participants. The data will be collected from 10% at Betis High School for the school year 2021 to 2022 will reflect the population.
Thank you again, Ms. Cyril Barrera. For the definition of terms, phenomenon, it is defined as the observable fact or event. Perceive, become aware or conscious something. Aspiration, a hope or ambition of achieving something. Necessities, the quality or states of being necessary. Contraceptives, a device or a drug serving to prevent pregnancy. Insufficiency, it is the states of being not enough. Demographic, a particular sector of a population. Unauthorized, not having official permission or approval. Administration, the management of public affairs or government. HIV, the human immunodeficiency virus that gets from the transmission most commonly in sexual intercourses. Quel, a condition which is consequence of a previous disease or injury. Acculturation, assimilation to a different culture. Legislative act, an assembly with the authority to make law for a political entity such as a country or a city. Illiteracy, an ability to read or write. Childbearing, a process of bringing up a child or children. Prenatal, before birth.